Welcome back. In the U.S., nearly 160 million people, including all Bronx children, reside in areas with a shortage of mental health care professionals. Recent news from Montefiore reveals plans for a new pediatric inpatient psychiatry unit aiming to address the urgent behavioral and mental health needs of Bronx children and adolescents. Here now to tell us more is the Unified Executive Administrator of the Department of Psychiatry and Behavioral Sciences at Montefiore Health System, Salimah Velji. Salimah, thank you so much for joining me.
Thank you for having me. Delighted to be here.
Now, can you provide an overview of the new pediatric inpatient psychiatry unit that Montefiore is planning to establish in the Bronx?
Absolutely. So we are in the planning stages of opening a 21-bed child and adolescent unit for kids aged 5 to 17 years old. This will provide intensive treatment for people with serious behavioral health conditions, including severe depression, anxiety, trauma, those having suicidal thoughts, and other acute psychiatric issues. This will be located at the New York City Children's Center in the Bronx, and it'll be serving over 350 kids per year.
Now, what prompted the decision to create this unit?
It's a great question. Currently, as you may know, we are underbedded in the Bronx, meaning we don't have the capacity or the number of beds available close to home in the Bronx community. So oftentimes our children in the Bronx and other places are waiting in emergency rooms, waiting to get connected to care, and often traveling far from home, both their kids and their families. So really providing this unit and developing this unit will allow us to have beds closer to home for kids that need them, and reduce the stress for both the kids and their families for traveling to have to leave the Bronx to access this level of care.
Now, I understand that there was funding for this initiative and it was $6 million. Can you explain, what effect you see it having on addressing the mental health needs of children and adolescents in the Bronx?
Absolutely. So the 6 million in funding is for capital investments to renovate the unit and to make it a comfortable unit for kids with this level of care in the acute setting. So it's to create these 21 beds, the infrastructure for those beds, the rooms for those for the type of care we're going to have, whether it's group therapy, family therapy, and really the idea is to make this environment comfortable for kids in these distressed states. So as just an example, we're working with our arts and integrative therapy group to actually think about how to create art from kids that are actually struggling with mental health issues and to be able to put that in that space to, again, make people relate to the space, make it familiar, make it comfortable, and make it therapeutic.
And I'm just curious to know what are some ways that this may differ from an adult center that focuses on, mental health and psychiatry?
Yeah, it's a great question. So the environment will definitely be different. I think it'll be more colorful. It'll have different components. There's also going to be some functional things. So, for example, kids will be accessing education in school through our unit. We'll have creative licensed arts therapists, so folks that are trained to provide therapy through fine arts and music. And that is something we have in the adult setting, but I think will be even more prominent in the children's setting. And I imagine there'll be more opportunities for community and interactions in our community rooms. So there'll be more play-based items. There'll be access to playground outside, and of course, access to a gym. So a few other perks I think that'll be really helpful and healing for our children in this space.
Now, could you elaborate on how Montefiore plans to provide culturally attuned and inclusive care within the pediatric psychiatry unit, especially considering the diverse population it serves in the Bronx?
Absolutely. So this is definitely a familiar mission to us, of course, providing care for our underserved communities and diverse communities. I think that we will certainly have staff that are diverse. We will have bilingual care and culturally attuned care in that way. We'll be innovating in this space. So I think one of the things that you may know is that we've already been very innovative at Montefiore in the child and adolescent mental health space. We had the first DBT program in the country. So to be able to extrapolate that and to provide that level of state-of-the-art care in our community, I think will set the bar for how children in mental health care should be provided and hopefully be extrapolated to other urban diverse communities.
Now, how does Montefiore envision collaborating with community partners to ensure the success and sustainability of this initiative?
So that's a crucial point. Oftentimes when people leave our emergency rooms or inpatient settings, the most important thing to keep people stable is to have those connections to community organizations. We're fortunate that we work hand in hand with our community organizations all the time. So we'll be doing that in addition to connecting people to other levels of care that exist within our system. So whether that's outpatient, traditional outpatient care, whether that's intensive outpatient care, where people are being treated for several hours of therapy over a number of weeks, or urgent care settings. So we'll be able to help bridge those connections, and I think we'll have staff that are trained to do that, just exactly that, to work with community organizations to make sure people are connecting to care that they need, and also connecting them to different levels of care, whether that's stepping down, having less intense care, or stepping it up and providing more acute intensive care.
Now, what message would you like to convey to the families and communities in the Bronx who may benefit from the services provided by Montefiore's new pediatric psychiatry unit? And I also want to emphasize the importance of like family in this situation, especially here in the Bronx. Mental health is a hard thing to address for a lot of people. So, what message would you like to convey to these families?
I think Montefiore would like to convey that we're here for you. This is a partnership when it comes to addressing mental health. When we take care of our kids in the medical settings and in the psychiatric settings, we know that we're taking care of families. And that it's super important for families to know that we're engaged in this care with you. We're partners with you. We want to provide this care closer to home. We want to reduce the stress that our patients and families have. And we're really here for you. And I think very open to continuing to learn and evolve our care so that it's meeting the needs of our communities, and in particular understand the importance of this family partnership.
And lastly, do you have any goals, specific goals or milestones that you can share that Montefiore has set for the pediatric psychiatry unit in terms of patient outcomes and community impact?
Absolutely. So just from a timeline perspective, we're currently working on our different applications for regulatory approval. Once we have those approvals in place, we'll be starting construction, and we're already underway with operational planning to have different clinical workflows designed so that we can hopefully open the unit within the year of 2025. In terms of outcomes, we are looking at a variety of things, whether that's reduced length of stay in emergency departments, the readmission rates, when people are leaving our units, the ability for them to stay stable and not come back to the unit quickly, so 30-day readmission rates, and patient satisfaction. I think we're going to be really thinking about how to make sure the patient and family experience is unparalleled. So, that'll be a goal to sort of look at all of those things, both clinical outcomes, operational measures, and then also thinking about our patient experience and our patient and family experience.
Well, I just want to emphasize, the importance of this initiative. Mental health is something that I think our society is moving forward and closer to, and just understanding and providing treatment for so many different types of people. So I want to thank you so much for joining us and kind of letting the Bronx know what is out there for them. So thank you so much.
Thank you. Thanks for the opportunity.
For more information, you can visit the website at psychiatryassociates.montefiore.org.